Hello, my name is Mamie Allen, and I'm an instructor here at Ultimate Medical Academy. In today's lecture, we'll discuss the integumentary system, specifically the hair, the nails, as well as our sweat glands. Now, this would be our part 2. So in part 1, we've discussed the structures. Now we're moving into the pathological conditions that may be associated with that integumentary system. So let's dive in. We first begin with our sebaceous glands. Now, as our sebaceous glands are associated structures of this system, there are also pathological conditions that can occur. Here we have acne vulgaris, and this is commonly known as acne. This would be a chronic inflammatory disease that's characterized by pus eruptions of the skin, and this pus causes an overproduction of oil around our hair shaft. And then we also have comedo, and this would be an infected lesion that forms by the buildup of oil and keratin in our hair follicle, and this often comes from or can be associated with acne. Some other conditions under sebaceous glands would be an epidermoid cyst, and we can break that term down. Epi meaning outer, and derm is relating to the skin. And cyst, of course, would just be a closed sac under the skin. Now, within the epidermoid cyst, there would be yellow fatty material storage. We also have seborrhea, and this would be an overproduction of oil, or that term would be sebum. If we were to break this term down, we have sebo, meaning sebum, and then rhea, the suffix meaning flow or discharge. Let's now turn our attention to disorders of the sweat glands, starting with anhidrosis. This is the abnormal condition of lacking sweat, which is in response to heat. Breaking this term down, an means without, the HIDR, hydro, would mean sweat, and then the suffix of osis means abnormal condition. Diaphoresis. This would be profuse sweating. Dia is meaning through or complete, whereas the for means movement, that PHOR, and then the esis, the ESIS, would mean abnormal condition. This is a normal condition when brought on by heat or exertion, but can also be the body's response to some emotional or physical distress. And then we have heat rash, which is probably familiar to us all. We also can refer to a heat rash as prickly heat, and this would be an intensely itchy rash that's caused by blockage of the sweat glands by bacteria and other dead cells. Moving on to disorders of the hair, we have folliculitis, and this would be inflammation of our hair follicles. Breaking this term down, follicular means the hair follicle, and itis, as we know, means inflammation. Now, this condition is more common on our arms, legs, and in the beard area of men. Look at the next one, trichomycosis, which is a superficial bacterial infection of our hair shaft in areas where there's a lot of sweat glands, such as our armpits. Let's break this word down. Tricho is meaning hair, my meaning fungus. The osis is a suffix that means abnormal condition. Now, those that suffer from excessive hairiness may have the condition hirsutism, and this would be the presence of excessive body and facial hair in women, and this usually occurs in a male pattern. So if we were to break this down, hirsute, that Hirsut, would mean hairy, and the ism is a suffix that means condition. Now, this condition can be hereditary, or it could be caused by an imbalance in your hormones. We now move on to the opposite of that hairiness. We have abnormal hair loss. Here we have alopecia, and this is also known as baldness. This would be the partial or complete loss of hair, most commonly on the scalp. Breaking this term down, the alopecia, the ALOPEC, would mean baldness, and then the suffix of IA pertains to condition. We also have the condition alopecia areata, and this would be an autoimmune disorder that attacks our hair follicles, which causes those well-defined bald areas on the scalp or other places on the body. This condition will often start in childhood. When you hear the term ariete, this means it occurs in patches. Let's now turn to some disorders of our nails. Clubbing is one. Here, clubbing would be the abnormal curving of our nails, and is often accompanied by an enlargement of our fingertips. Now, this condition can be hereditary, but it's usually caused by changes that may be associated with deficiencies in oxygen. There are also disorders involving the skin pigmentation. Here we can see age spots. Now, age spots may also be referred to as liver spots, and this would be discolorations that's caused by sun exposure. Although harmless, these spots may sometimes resemble skin cancer growths. And then we also have albinism, and this is a genetic condition that's characterized by a deficiency or the absence of pigment in our skin, our hair, and also the iris of our eye. If we were to break this term down, albin, A-L-B-I-N, means white, and then we have ism, which is the suffix meaning condition. Now, this condition would be the result of any missing enzymes that would be necessary for the production of melanin. Remember, a person with this condition you'll hear referred to as being an albino. Chloasma. Chloasma is also another type of skin pigmentation disorder. You may hear it referred to as either melasma or the mask of pregnancy. This would be a disorder that's characterized by brown color spots on your face. Normally this will occur during pregnancy, but normally it will also disappear after the delivery. We also have vitiligo, and this is a skin condition resulting from the destruction of the melanocytes due to unknown causes. Remember, melanocytes means melanin cells. Now, vitiligo can cause irregular patches of white skin, and this is a process we refer to as depigmentation. Hair growing in an infected area may also turn white. Due to certain external causes or injuries, there may be bleeding into the skin. Contusion would be an example of that. A contusion is an injury to our underlying tissues without actually breaking the skin, and it's characterized by discoloration and pain. Let's break contusion down. Contus, the C-O-N-T-U-S, means bruise, and the suffix of I-O-N, or zun, means condition. Now, this discoloration is caused by an accumulation of blood within the skin. Here we see an actual cross-section of the skin, which shows bleeding under the skin, which causes a condition known as ecchymosis. Now, this is also known as a bruise, and this would be a large, irregular area of a purplish discoloration that's due to bleeding under the skin. Let's break this term down. The ecchymo means pouring out of juice, and the osis would mean abnormal condition. Some other conditions causing that bleeding under the skin, we have petechiae, and this would be very small hemorrhages that are less than 2 millimeters in diameter. Now, these hemorrhages will sometimes result from someone having a high fever. Next, we have a hematoma, and this is usually caused by an external injury. And here you'll have a swelling of clotted blood that's trapped in tissue. So if we break this term down, the hemato means blood, and the oma is the suffix meaning tumor. Now, eventually the body will reabsorb this blood. A hematoma is often named for the area where it originates or where it occurs. Lesions through the skin may also occur. Here we have an abrasion, which is a type of lesion. This would be an injury where the superficial layers of our skin are either scraped or rubbed away or off. Moving on to a fissure, this would be a crack-like break in the skin. So think, in between the toes we have this fissure, and it's also considered athlete's foot. Keep in mind the term fissure can also be used in other body systems, such as in the folds and the contours of the brain, which I think you may have learned in the nervous system chapter. And then we have a laceration, which is just a torn or a jagged wound or an accidental cut of the skin. From this figure, we can see in picture A a fissure where the skin is a groove or you see that crack-like sore. However, in picture B, we can see an ulcer. And an ulcer would be an open lesion of the skin or the mucous membrane that results in tissue loss around the edges. Note, ulcers also occur within the body, not just on the outer edges. Birthmarks. A birthmark is a mole or a blemish on the skin that's present at birth or shortly thereafter. Some birthmarks will fade as the child gets older. Here we have pigmented birthmarks, which include a nevy, and this also are known as moles. Now, keep in mind, this is just an irregularity in the color of the skin. We also have vascular birthmarks, and these are caused by those blood vessels that's close to the skin's surface. These would be the most common type of birthmark, and they're sometimes called salmon patches and red birthmarks. We also have other skin conditions such as dermatitis. Think of breaking this word down. Itis is meaning inflammation and derma is referring to the skin. So a dermatitis would describe an inflammation of the skin. Normally with dermatitis, the patient may experience redness, swelling, as well as itching of that area. Now, when looking at dermatitis, there are different types. We have contact dermatitis, and then we also have eczema. So looking at contact dermatitis, you may see the abbreviation CD, and this would just be a localized allergic response that's caused by either contact with an irritant, such as a diaper rash. Now, this can be caused also by exposure to an allergen, such as poison ivy, or maybe to latex gloves. And then we have eczema. Now, eczema may also be called atopic dermatitis, and this would be a form of persistent dermatitis, or we can say recurring, meaning it's happening over and over again. Normally, this would be characterized by redness, itching, and dryness, and some possible blistering and cracking or bleeding of the skin. Now, this chronic condition, chronic means occurring over a period of time, most often may be seen in infants and children, and it appears to result of a malfunction of our body's immune system. Here we have parasitic skin infestations. An infestation is the dwelling of microscopic parasites that sit on the external surface tissue. Some parasites will live temporarily on the skin, and others may lay eggs and reproduce there. So let's take a look at a couple below. First, we have pediculosis, and this is an infestation with lice. When we break that term down, pedicule means lice, and the osis, again, is the suffix meaning abnormal condition. Now, in order to get rid of this infestation, the lice eggs, which are known as nits, must be destroyed. Now, there are three types of lice that you should know. We have pediculosis capitis, and this would be head lice. And then we have pediculosis corporis, which is body lice. And then we have pediculosis pubis, and this would be an infestation with the lice in the pubic hair or the pubic region. We also have the next condition called scabies, and this would be a skin infection that's caused by an infestation of itch mites. Now, these tiny mites cause small itchy bumps and blisters by burrowing or drilling into the top layer of our skin to lay their eggs. Now, there are medications that may be applied to kill these mites. However, the itching may persist for several weeks. We now turn to abnormal skin growths. You may see the words polyp or skin tags. Polyp is just a general term, and it's used most often to describe a mushroom-like growth from the surface of our mucous membrane. Such a polyp in the nose may be common. Also, these growths can have many causes, and they're not necessarily malignant, meaning life-threatening. We also have the condition of skin tags, and this would be small flesh-colored or light brown polyps that would hang from the body by these fine stalks. Now, these skin tags are benign, and they tend to just grow as they age. Remember, benign is the opposite of malignant, meaning non-life-threatening. A skin cancer would be a malignant growth on the skin, and it can have many different causes, including repeated severe sunburns or possibly long-term exposure to the sun. Now, skin cancer is becoming more common, and it affects many Americans. There are about three main types of skin cancers. We have our basal cell carcinoma, the squamous cell carcinoma, and melanoma. So let's take a look at each of these. For the basal cell carcinoma, this is a malignant tumor, right? Meaning life-threatening. And this would be a malignant tumor of that basal cell layer of our epidermis. This is the most common, but the least harmful type of skin cancer there is, because it grows slowly and it rarely spreads or metastasizes to other parts of the body. Now, with this type of lesion, they may normally occur on the face or the neck, and they tend to bleed easily. Next, we have the squamous cell carcinoma. Now, this will originate as a malignant tumor of a scaly squamous cell of the epithelium, which is one of those layers. However, it can quickly spread to other body systems, which may make it more deadly. Now, these cancers begin as skin lesions that appear to be sores that will not heal, or they may have a crusty appearance. Then we have a melanoma. Now, a melanoma is malignant, and this would be a type of skin cancer that occurs in our melanocytes. Remember when we break that term melanoma down, we have melano, which means black or black pigment, and then the oma means tumor. And remember, the oma is considered the suffix of the word. Now, these malignant melanomas are the most serious type of cancer, and often the first signs would be changes in the size, the shape, or the color of a person's mole or their body mold. The next condition here are burns. A burn is an injury to our body tissues that is caused by heat, flame, electricity, sun, chemicals, or radiation. The severity of a burn is described according to the percentage of that body surface that may be affected. It's also described according to the depth or the layers of skin involved. So we have different classifications of burn, or we can say of burn severity. The first type would be a first-degree burn, and this is also known as a superficial burn. Here, there are no blisters, and the damage is superficially to the damage or the surface of that epidermis. And then we have a second-degree burn, and this includes partial thickness, which means it extends a little deeper than that superficial layer. Here, we will have blisters, and there's damage to the epidermis as well as the dermis, which is that layer under the epidermis. And then we have our third-degree burn, which includes a full thickness burns, meaning it extends deeper into those layers of skin. Here, there will be damage to the epidermis, the dermis, and the subcutaneous tissue, and possibly the muscle and the bone below. So remember, when we're thinking of the layers of skin, it goes the epidermis, the dermis, the subcutaneous layers, and then under the subcutaneous layers, it goes into the muscle and then extends into the bone where it ends. Let's now move into some diagnostic procedures used to treat disorders of the integumentary system. So we have a biopsy, and a biopsy is used to determine if a cell may be cancerous, malignant, or non-life-threatening. We can say benign. So when you think of a biopsy, this would be the removal of a small piece of living tissue in order for it to be examined to confirm or establish a diagnosis. So we can also break the term biopsy down. Bi means pertaining to life, and then we also have opsy, which is the suffix that means the view of. Now, with biopsies, we have different types. We have an incisional biopsy, which means a piece of, but not all of the tumor is removed. And then we have an excisional biopsy. Now here, the entire tumor or lesion is removed, as well as a margin of the surrounding tissues. Excision means the complete removal of a lesion or of an organ. And then we also have a needle biopsy. And here you would have a hollow needle that's used to remove a core of the tissue for examination. In dealing with skin disorders, there are some treatment procedures that can involve preventive measures, meaning taking actions that can prevent the condition from actually occurring. So let's take a look here. We have sunscreen as one preventive measure. The purpose of the sunscreen is to block out any harmful UVB rays that may come from the sun. Now remember, this is measured by the strength of that sun protection factor, which is the SPF. Some sunscreens will also give protection against the ultraviolet A UVA rays. Depending on the depth of the burn or the layers involved will also depend on the type of treatment that is received. The type of treatment for a burn will depend on the degree, meaning that first, second, or third, and as well as the body surface that may be involved. Now, you may have a hospital burn center that will provide care for more serious burns, and this would include any pain relief, any debridement, which is the scraping of the skin, as well as dermoplasty. And dermoplasty is just a fancy way to say skin grafts. It also may assist with providing IV fluids, and IV is just meaning fluids that are administered intravenously, meaning through a vein, and it will also provide some nutritional supplements that may be needed in rehabilitation. Depending on the severity of the tissue disease, tissue removal may be required, and here are some different procedures. We have cauterization, and this would be the destruction of tissue by burning. We also have chemoabrasion, and this is also known as a chemical peel. This would be the use of chemicals used to remove the outer layers of the skin, and this is sometimes used to treat acne scarring, wrinkling, and also keratosis. And then we have cryosurgery, and this is also called freezing. And this would be the destruction or eliminating any abnormal tissue cells, such as warts or tumors. And this occurs through applying very cold devices, such as liquid nitrogen, over the affected area. If we were to break this word down, cryo is meaning cold, and surgery just means an operative procedure. We also have curettage, and this is the removal of any material from the surface by scraping it off. One will use this technique to remove any basal cell tumors. Then we have debridement, and this is the removal of any dirt or foreign objects as well as damaged tissue and debris from the wound. And this purpose is to prevent any infection and to promote healing in a timely manner. And then we have I&D, which is irrigation and debridement. And this is a procedure that has a pressurized fluid, and this is used to clean out the wound to rid it of any debris. We now turn to looking at medications that are used to treat skin disorders or diseases. First, starting with retinoids. Now, retinoids will be a class of chemical compounds that are derived from the vitamin A. And this is used in skincare as well as treatment because it promotes that epithelial cell growth. However, using retinoids can make your skin burn a bit more easily. We also have topical steroids, and an example of a topical steroid would be hydrocortisone. Now, this as well as other variations are used to treat various skin disorders and diseases. Now, these drugs, which are derivatives of natural corticosteroid hormones that are produced by our adrenal glands, they must be avoided. Why? Because they can have potential harmful side effects, which can include irreversible thinning of the skin. And we'll end today's lecture by taking a look at now some cosmetic procedures that are elective, meaning the patient may choose to have this procedure done even though it may not be necessarily medically required. So let's take a look at some here, starting with blepharoplasty. This is also known as an eyelid lift or a lid lift. And this is the surgical reduction of the upper and lower eyelids by removing any sagging skin. So let's break the term blepharoplasty down. We have blepharo, meaning eyelid, and then we have plasty, which means a surgical repair. The next procedure, Botox. Botox would be a formulation of the botulinum toxin. Now, this is the same neurotoxin that's responsible for the form of food poisoning known as botulism. Now, when small, the sterile doses are injected into our muscles on the forehead, and this can temporarily block the nerve signals to the injected muscle for a few months. This will reduce the moderate to severe frown lines that you may see between the eyebrows. And then we have collagen replacement therapy. This is a form of soft tissue augmentation, which means change, that's used to soften facial lines or those scars, or to make one's lips appear fuller. Tiny quantities of collagen are injected under a line or under a scar to boost the skin's natural supply of collagen. And this will normally last for about 3 to 12 months. Now, in today's lecture, we review different anatomical structures that are relating to the integumentary system. Remember to look at those prefixes, the combining forms, as well as the suffixes to create new words. Good luck in your studies this week. Thanks for joining me today.